Kamani.
Welcome to another episode of Practice Prosperity. We're joined today by Dr. Ria Sahara. She's a dentist, and we're going to cover a lot of ground here. We're going to start off with how she purchased her practice, what she had to do to make sure she is fine and tuned within her practice. We're going to cover things like marketing, and also what is it like developing an employee base and also making sure that they're engaged as employees. So this is going to be a fun episode. We're going to cover a lot. So thank you for joining us.
Thank you for having me.
All right. To start off, can you describe your dental practice and the type of patients that you serve?
My practice is called Gentle Dentistry of Newnan. We are in the Newnan area, and we are a gentle practice dentistry. So we do everything from fillings, dentures, implants, of course, cleaning, everything.
What is it like being a dentist? Like, what do people need to know? Just being a dentist, waking up day in and day out. What is being a dentist like?
Well, being a dentist is one thing, and having your own practice is a whole nother ballgame. Being a dentist, most of us are very meticulous, very detail oriented. So I like to, accomplish perfection with my patients. If something's not right, I want to do it over again. Most patients can't even see what I see. But I would like to do my best. I would like to do everything that I would want on me. So, but owning a practice, you definitely take it home with you. You think about patients, you think about staff, you think about every little thing in the practice. It's never leave work at work and then come home. It's always with you.
Yeah, I think that's tough, and a lot of business owners don't know this going into it. How do you balance that never turn off feeling? Like you have to have something to cope. I've heard therapists, they wash their hands in between each session to say, hey, this is the beginning, this is it. Have people who take a longer ride home. Like, what is your coping mechanism of being a business owner and all of the things that we have to go through?
I definitely do have a long ride home. Like I said, my practice is in Newnan, and I live in the Atlanta area. So I have a 45-minute commute. So I listen to podcasts and audiobooks, and that is my let go period.
Yeah, I could definitely see that. So you mentioned, you really focus on like the patient experience. And a lot of people are scared to go to the dentist. The idea of sharp objects being pointed towards their mouth. Like, what is your experience with, patients who've maybe have had bad experiences with other dentists? And how do you adjust for that, knowing that they're not coming in purely with the open mind?
Yes. I've found that most of the patients that come to see me have had a bad experience just based on the name of the practice, Gentle Dentistry of Newnan. They're seeking someone gentle. They're seeking someone who's going to understand where they are. And I do just that. Most patients say that they just didn't feel heard. They didn't feel understood. They didn't understand what was going on. And I take my time to explain things to them in layman's terms, of course, what's going on and what needs to be done.
Yeah. How do you prevent the natural thing of a practitioner or business owners of a patient becoming a number and not a person? Like, how do you maintain the personhood of your patients where you actually hear them saying, I think you seem uncomfortable with what's going on? Like, how do you maintain that state of mind?
It is hard because when you run a business, there is financially checks and balances where you have to say, okay, I spend this amount of time and I need to make this amount of money. But when you have patients, not every patient is going to take the same amount of time for the same procedure. So I pride myself in taking my time, even if I'm going over, my staff is not happy. But I want to understand what is going on with that patient. Like I said, most of them come with fears. So they're a little bit nervous and they might have to stop a couple of times and or get up or talk to you. I take my time and say, hey, you're going to be okay. You don't need medication to do this. We can talk you through. Um, that's what is important to me, to understand that everybody comes with different experiences. I just meet them where they are, basically.
Yeah. I work with a lot of different clients who do a lot of different professions, but I also talk to their kids a lot. And they talk about what they imagine their career to be. So help me contrast you going into dental school, what you thought your career would be, and what it is today. Like reconcile that for folks just going into dental school, wanting to become a dentist.
Oh my goodness, going into dental school. Um, I had no idea what realm of dentistry I would be in. I just knew that I liked the science of it. So in upon like graduation, I just thought, okay, well, I'll just work in a practice, get experience, and that'll be it. I never thought that I would own a practice. It kind of fell in my lap, a good thing. Don't get me wrong, I worked hard for it. It wasn't like it fell in my lap easy, but it was an opportunity and I went for it. But when you're in dental school, you kind of have the thought of, I just got to get through it. I got to take this one exam. I got to take the boards. It's just that first step, and not looking at the full picture. So I understand it is a big decision to make, and you don't really know what direction to go, because in dental school they focus on the didactics and the clinical work. They don't focus on like running a practice or the business of it or the options of coming out of dentistry, what career wise. They don't really focus on that in dental school.
So we hear things in society about, pushing through law school, level one, level two, level three. Any advice to a student trying to get through dental school? Like what is the hack, or what is something they have to persevere through that we in the general public just don't know?
Persevere. Dental school is hard in that they teach you the foundation, but they want you to formulate your own way of doing things, basically.
Mm-hmm.
When you have, like, if you go to a conference full of dentists and we're talking about a treatment plan for a patient, you might have 100 people in there, but you'll have 20 different treatment plans because we go about things differently. And that's a good thing because it brings innovation, technology, everything into the picture. So in dental school, it helps you form your thought process, your analytical skills, things like that. So I would say hone in on who you are, like what type of dentist that you want to be.
Yeah. Yeah, I think that's good. I think it's good. So you're probably at the last year of your dental program, and you decide to enroll yourself into this program. And this program is set up for you to be paired with another dentist. Kind of explain how you got to that point to enroll in that program and your journey through the program in the beginning.
Sure. The program was called Mercer. I don't think that it's available now. I think it's just a financial institution. So I looked up in getting into that program. I was in my general practice residency, and it was a CE course. And I just went in there and I said, "What is this?" And they said they matched practicing dentists or practices with an associate. And I said, well, I'm coming to Georgia. Let me see if I can match with someone. And I did. She was wanting to cut back because she was having a baby. And so that was perfect for me. And I was just getting started building my patient pool. And it was a great program in that it set you up to buy into the practice. First, you developed an LLC, saved up your money. No, don't get me wrong. When you start practicing, you don't have any patients, you don't have any money, you make less money than hygienists, especially nowadays. So it takes a while to build up your patient pool. It basically trusts. People have to trust you, know who you are. And so I was lucky in that this was an established practice, and there already was a patient pool in the community, and the staff got to know me, and therefore, when the staff gets to know you, the community gets to know you. So,
Now,
um,
explain. So this practice prosperity. Explain the realness. So you have your cap and gown. You graduated. You're a doctor now, but you have to. It almost feels like you're starting back at zero. Everybody's calling you doctor. Everybody acknowledging that you're a dentist, but your checking account isn't reflecting that on a month in, a month out basis.
yeah.
Like, what? How did that feel?
Um, it did feel like you were starting all over again. Absolutely. But you have to begin with the end in mind, know where you want to go. Like I said, what type of dentist that you want to be, not necessarily specific, like specializing, but the mindset that you want. Do you want to be a dentist that's in Atlanta or Alpharetta and practicing and fee for service and do cosmetic work? Or do you want to be a dentist that takes a Medicaid? Do you want to be a dentist that, you have to really understand what will make you happy? Because at the end of the day, you want to come home and say, okay, I feel fulfilled. I feel like I made a difference. I did something right. You don't want to come home as tired as you are, feel like, oh my gosh, what did I do? So you have to establish who you are, basically your boundaries. What are you going to do?
That's good. That's good. Now, at what point did you begin to make more than a hygienist? Like, how many months, years did that take to say, I can afford a car note, I can pay rent by myself? Like, what year did that happen?
Yeah. When I first came out of my residency, I was living with my parents
Mhm.
for years. And then after a while, I did establish the LLC, and I was saving up. So most of my money went towards the LLC.
Mhm.
So even when I was making some money, I was saving it up for the practice. But it takes I would say at least 5 years or so to really get going and making those six figures. I know that sounds harsh, but it is that.
Yeah, yeah, I can see that. So, like you said, you're not practicing in a major city. You're going in a more rural area. Can you contrast a dentist, if you know somebody in your network who's working in a major city versus you're working in a more rural on the outskirts practice? Like, how do you think about that? And what are the pros and cons of those two business models, practice types?
Yes. Newnan is a very small town, and in a small town, relationships matter.
Yeah.
You will see someone, and word of mouth is the best form of advertisement. So you have to build the trust in the community. You can do it many ways, of course, marketing, but you have to get out there to basically let your community know who you are and what you stand for. I would say events in the community, festivals. You can there's churches, there's organizations in the community that you could join. So that would be the way I would say.
Awesome. So when you're in doing these community events, will you have a stack of business cards handing them out? Will you have a flyer on the stand somewhere? Or is it just old school blocking and tackling? Hey, my name is XYZ. This is what I do. Like, what was your approach of getting ingrained in that Newnan community?
Okay, always have business cards,
Mhm.
always on you.
Yeah.
Because everybody says, "Oh, I need a dentist." Oh, and they'll show you their teeth wherever you are. They'll be
That's
like, "What can you do about this?" And I'm like, yeah." So always have business cards on you. But you'd be surprised once you establish a connection with someone,
Hmm.
they'll look you up and they'll
Wow.
find like where you are, as long as they know a first name or a last name or something. Or in the community, they might ask someone else who you are. So that's why it's so important to do marketing so that you have platforms that show who you are, um, like Instagram or Facebook. So yeah.
Now, this may be a little funny, but I'm curious. Do you walk around with that small little stick mirror thing? So just in case somebody asks you for something, and maybe a picture book of this is the ailment that this represents. Like
No,
how
I
far
want
will
the
they open
opposite
their
of
mouth?
that. I don't
Okay.
want people to ask me what's going on in their mouth right there because it's kind of hard to make a diagnosis on the spot without x-rays and everything like that. But yeah, people, it doesn't stop people. I mean, in the grocery store, everywhere.
It's like you're just the right person I want to see. Look at this right here. I can see that.
Hmm.
So your first day, you're the new hotshot coming out of college, walking into an already established practice, already established patient load. What were the first couple of days like? Like, what was it being in the office, having to show up every day? Like, it's a little different from school.
Oh, it's absolutely different from school. It was a while back. So if I remember correctly, I remember the time constraint being an issue.
Hmm.
Because in school you have several hours to do like, one filling. But now you're, like I said, you're on a limited amount of time because you have a goal financially to make, and you have to be cognizant of everybody else in the practice, both the hygienists, they have a schedule to abide by. So it is a time constraint, but you get over that real quick.
Yeah, yeah, I can see that. I can see that. So let's talk about the emotional level of somebody buying a practice. So we're going to talk about the first tranche, the first half of your purchase. What was it like siphoning this money to the side every month? Like very few people ever buy a business. So you're doing this coming out of your, doctoral program. Like, what is it like having this pool growing for this initial purchase? What was going through your mind?
It is a huge sacrifice. When you're coming out of school, you're like, okay, I did it. I want to reward myself with that new car. I
Yeah.
want a house. I want all these things. You have to begin with the end in mind and look at the big picture and say, okay, this is what I want for myself. I'm investing in myself and not in just material things. Don't get me wrong, the material things are great to get them, but you got to put them off for a little bit. So it is an investment and it's hard. It really is because you see other people coming out of school and you're like, I want that too. So it is adjustment period and thinking, what am I going to do? What am I going to do? And how long is this going to be? Like, how long am I going to make this sacrifice? And you need a support system. I luckily had my parents. Like I said, I lived with them for several years.
Mhm.
And that was different being an adult living with your parents.
Mhm.
So
Mhm.
it is difficult, but you have to just understand what's the most important to you.
What is your thought process on earning trust with the dentist that you are joining and also the staff? Because yes, you have the degree on the wall, you're talented, but then there's the softer people element of this person has to enjoy being around me. This person has to know that I have their best interest in mind. Like, did you have a strategy? Did you do something that you felt like really moved the needle? Like, what was that for you?
Oh, I didn't have a strategy. I was just vulnerable.
Mhm.
I opened up and let the staff and of course the practicing dentist at the time know who I am. We talked about family, friends. Um, I was curious and I was open because I was just moving to the area. So I wanted to learn not just about the area, the community, everything. So it was easy. It was easy to be vulnerable. But it is, for some people, it might be uncomfortable to be vulnerable like that. So, yeah.
So, and did you find the person you're purchasing the dentist practice from, was she equally as open? Was she equally as excited? Like, how was that dynamic?
She was absolutely, and I was blessed to find someone that was equally as open. Yeah.
Mhm, mhm. So let's go to first check writing day. So the day has come for you to purchase your first tranche of a two purchase process for you. Um, how did it feel writing that check to that person? Did you feel differently about the practice itself now that you were a partial owner? Like, what was that for you?
Well, I did feel different. I felt, I hate to say this, but a huge burden because
Mm,
now it's not just showing up at work. You're
yeah,
showing up to your investment.
yes.
So it is different, but it's a good different. Like I said, it's an investment in yourself. It's something to be proud of. It is, you walk in with your head up and say, this is mine, or at least half mine at the time.
Mhm.
So yeah, absolutely. It is an accomplishment.
Yeah.
So
Speak a little bit more about that mind shift as being an owner. Were you thinking more analyzing the bottom line because that's how you got paid a little bit? Were you analyzing more of the customer experience? Like, what was there any like major shift when you became a partial owner?
well, again, I was coming into ownership, still learning and growing in my leadership skills.
Mm,
So it it is a period where you're learning. I wouldn't say trial and error,
okay.
but it is a period where you kind of figure things out like on the fly. So to give you an example, I had a hygienist there and she she was very enthusiastic about cosmetics.
Yeah.
She was like, yeah, I think you should do Botox and you should do this. And I'm like, I'm really not interested in those things.
Yeah.
She's like, no, everybody in the community wants this. And so I opened the conversation up to her and made sure that she felt heard, but showed her that it wasn't the right direction to go for me in my practice. So you have to have conversations and not shut people down and understand where they're coming from. So.
And I think it's in the word, you alluded to it a little bit. It's a practice, meaning every day you try to get better. How did you become at peace with maybe not showing up as your best self in any given day and knowing that I'm going to try better tomorrow?
Oh, that's hard.
Hmm.
That's really hard because coming out of dentistry or dental school, we're somewhat perfectionists, like I said. So we are our worst critics. And but we're not trained in um, dealing with people.
Yeah.
So when you all of a sudden have a staff that you have to manage and navigate and let them feel like they're heard, but still understand that you are the leader, it's difficult to navigate that for anyone.
Hmm.
But and then try to make ends meet when you're buying into a practice, it's a lot of things to kind of juggle.
That is true. Like the staff doesn't fully understand and probably shouldn't have to understand the burden
Yeah,
of, being cash flow positive,
yeah,
burden of meeting payroll, all those.
yeah. I struggled with that, and when I became an owner, I was close to my staff, and so I wanted to tell them, this financial is going on, so we can't do this, or we're going to wait on this because of this. But I don't want them to think that anything's wrong, or because for me, I can see the big picture. I understand how cash flow works, but for them, it's very limited. So I want to be honest and say, hey, everything, what everything is, but you can't show everything because it scares people. So you have to make sure that they understand that, like, where the money comes from, but the logistics and the details, they don't really need to know.
I think it's tough for me as well. It's like I'm an entrepreneur for a reason. And for their choice, they decided to be an employee for a reason. And there's reason for that. And you have to be at peace with that. And I know for me that's hard because I'm like, why don't you want the same level of incentive?
Yeah.
But everybody's different. You got to honor that. I think that's hard to do for me anyway.
And yes, and I found in a team, different things motivate for different people. And it's not just money, it could be recognition, it could be all sorts of things. So you have to figure out what's important to your staff. You have to figure out like where you're going to meet them, what's important to them.
How did you develop that skill? Was that always innate in you? It's like, hey,
Oh
people
no.
love me. I know how to make people love me. Like, because that's hard. Like, how do you say this? Let's say you have a one-on-one meeting with somebody. It almost feels like 30 to 45 minutes is more on the personal side versus the task oriented in those type of meetings. Like, how do you think about that?
Well, first of all, not everybody loves me, and not everybody's going to love you. As far as staff goes, you're still the boss, and you're telling them what to do. So there's going to be some pushback, and there's going to be some people that just don't like to be told what to do. That's inherent. But as long as you present things in a way where you respect them and you make it known that, hey, this is where we are, this is where we need to go, and open to feedback openly, like not just say that, just openly open to feedback and want to grow. I think that is the key. But not everybody's going to like you. And in dentistry, in fact, most people don't like, I'm talking about patients. Most people show up and say, oh, I hate the dentist. So you have to have thick skin to be a dentist because you're on a time crunch. You have lots of pressures and stress coming from different areas, be it staff, patients, vendors, different things. So you have to be able to just swivel. So, yeah.
That's good. That's good. So let's talk about the big purchase. Okay. The final tranche, you're the owner now. So explain what happened to allow that opportunity to come to you within that time frame. And also, like, this is, I'm assuming, traditionally the last tranche is the largest check. So this is an even bigger check. So what was that like? So how did the second opportunity come for you to be 100% owner? And then what was it like writing that large of a check?
So at the time I was 50% owner. The practicing dentist, now my partner, she left for London. Her husband had a career opportunity. So they left for London for a couple of years. I was left in the practice, basically managing everything and doing everything on my own. That was an adjustment period. But I kind of had the notion that, oh, I can fall back on them because they still own the practice and they're helping me with the logistics of everything. But the day to day, I was shocked that I could do it by myself. And so when they came back to the States, they didn't want to come back to Newnan. They wanted to move to California. So I was presented with a choice of whether to sell my other half and move on, or buy the remaining shares of the practice. And I decided on the latter. So,
Wow. And let's take a step back. So they offer this to you. They say you could sell, which means you receive a large check, or you could buy in, meaning you're paying a large check.
yeah, yeah.
And so, I mean, I'm sure you're talking to family members, you're praying, like it's a lot of stuff going on.
Well,
Like,
yes,
what is that
this
like?
time, yeah, this time was unexpected. Like at first, I saved up for
Mm-hmm.
that first half. But
Yeah.
this, I didn't expect them to say, hey, we're not coming back to Newnan. I totally expected them to come back to Newnan and we just carry on as it was before. So financially, I hadn't saved. And it was an adjustment period getting loans and figuring out logistics of it all. But I did it. It worked out.
In hindsight, do you think that was like a little test that the owner did, was like, let's see what happens? And it tests even for her to get away and see what she thinks about life not being a regular practicing dentist. Like, what do you think about that? I'm just curious.
I don't know if it was a test for her, but it was definitely a test for me. Um, just to see that I could do it.
Yeah.
It just running a practice and managing the staff. The logistics, like I said, was done for me, like payroll and things.
Yeah.
But the everyday managing it can be cumbersome. So it was it was easy to adjust because I felt like it was sink or swim. I had to do
Mm-hmm.
it.
Yeah.
I had no choice. It was only me. So yeah.
But still, that is a tough thing for somebody coming out of dentist school to to write that check to become an owner. Um, what I feel like there had to be something inside you to want something larger, or to want to be the captain of your own destiny. Was that part of you? Because that is still a high risk move.
It is absolutely a high risk move. Um, because you don't know what the future holds.
Yeah.
Especially at the time, the economy, it was, let's see, '07, '08. I think that was the mortgage crisis.
Mm-hmm.
So you definitely were questioning, did I make the right decision? But it takes believing in yourself. Like, I want something more, and this is the way I'm going to get it. And you don't gain without risk. So
So the ink is dried. The practice is yours. You may remove some names off the door. Maybe, maybe not. You walk in the first day and it is 100% your baby. What was that like?
well, I had a little practice running things since they were gone in London. But it takes building a good team. That's what I
Mm-hmm.
found.
Mm-hmm.
Your accountant, legal team, marketing team, because you can't do everything. And you certainly don't know everything. So it takes a support system of a team.
Let's talk about the accounting side, because I'm in the finance world. What are some of, like, how did you get comfortable with the finances of the practice? And also, what are some like key metrics or things that you monitor to say we're doing good, or there could be some improvements?
Well, it's important to find a firm that is dentistry based. They're
Mhm.
out there.
Yeah.
So they understand the logistics of dentistry because
Yeah.
dentistry, the business is quite different and it's changing so fast with technology. For instance, we used to have reps distributing companies come to the practice and say, okay, this is your order for the supplies and we'll order it for you. Now everything is done online.
Mhm.
And that those reps are not coming to your office anymore. They're not telling you about new innovations or anything like that. So you kind of have to figure things out on your own and price things. There's different search engines and online shopping. So it is kind of like you're on an island right now. And so it's absolutely crucial that you have other dentist colleagues to run things by and say, hey, did you buy this type of material? What did you think about it? So that is important, especially in this day and age.
I agree. I agree. Now, on the P&L of your business, like, is there certain numbers that you look at more than others? Are you a big top line gal? Are you an expense lady? Like what on the P&L do you like laser focus on? Like, we're not doing this no more, or we're killing it.
I try not to be too hard on myself because there's fluctuations. I know different times of year. Um, there are peaks and valleys. Um, for instance, like going back to school, everybody makes appointments, but they don't show up for them. So you have to understand and not be depressed and say, oh my gosh, what is going on? Is it me? It's really people are just living life and getting back to their normal processes. And so you have to plan ahead and say, okay, you either save or do something more because you still got to make payroll. You still got to pay those bills. So it's all about planning. The bottom line, of course, you look at because there's a certain amount that you need to make things flow and work properly in the practice. And also you need a cushion because within a practice on a monthly basis, something is breaking or you need something new or so it's always good to have a cushion.
That's interesting. Like, what is the going rate for one of those spanking new dentist chairs? Like, well, how much does those things cost?
Oh yeah, I'm actually pricing one right now. One chair is probably about $20,000. So yeah.
That's a
Everything in
cushion.
dentistry is expensive.
I see that.
Yeah.
I see that. I see that. So let's talk about your marketing journey. Okay. So you have opted to get the help of a marketing firm. Like, let's first start off with what were your thoughts on marketing? Let's say as soon as you bought your practice, how did you think about how you're going to market yourself to where you are now? Like, explain that journey of getting there.
Well, absolutely. Randall, I am not a social media person. When I bought the practice and when social media became the thing to do, I didn't even have a Facebook account. Actually, my Facebook account maybe have one follower. Um, but and I got on Instagram seldomly, just to message like people. So I my thought on social media, now this I have to say this is the past.
Yeah.
But my thought on social media was it was vain. And who cares about what someone's eating, what they're doing? I was like, who would want to know any of this stuff about me?
Yeah.
Because it's meaningless. Like I didn't understand why it was necessary.
Mm-hmm, mm-hmm.
Um, but then I talked to a marketing team and they said, marketing is no longer sending out flyers in the mail. Marketing is allowing patients to get to know you because they're going to go to someone they know and trust. So you're going to have to open up to do that. And it was extremely hard because I'm a very personal person. I
Mm-hmm.
didn't want to open up my life in that way. Um, so it was definitely an adjustment to get in the mindset of doing reels and posts and things like that. But it's definitely necessary. I see the value in it now. And in fact, I kind of like it. So
That's funny. Yeah, I think it's what you said earlier, saying about cancellations during school season or back to school season. Um, People are going to be people. And unfortunately, it is what it is. People are online now. So that's kind of where you have to be.
you have to meet them.
How did you start to when did that happen? When did that switch? Did you like, hey, I look pretty nice on Instagram? Like when did you start to actually enjoy social media?
Well, it's not about looking nice. It's about the message that you put out there
Mm,
and just having it received. To have a patient come in and say, "Hey, I saw your post. I really like um, that you said this
yeah,
or you talked about this because I was wondering about that and I never wanted to ask because of whatever." It just opens up the the conversation,
yeah,
basically. So it allows someone to get to know you on a level that, because when you come into the doctor, you don't feel like you have that rapport to
yeah,
talk
yeah,
to them in a way and ask them all the questions. But if you open it up to them on social media, then they said, okay, well, she's a real person. I can talk to her about this. So
Any advice that your social media specialists have done for you that has really wowed you that you want to share? Like, okay, this is something that practice owners may want to think about when promoting and marketing their firm.
I really don't have advice. Just be open to not always looking and feeling professional.
Yeah, yeah,
It is a process, social media, in that uh, you have to get eyes on your page,
yeah.
in that you have to maybe go outside of your norm a little bit, but it's well worth it.
I like that. I like that. So we talked a little bit about managing staff. Um, when did you get to the point where like I know what type of boss I want it to be? Like when did you get there, or do you tailor your bossingness to each individual employee?
Honestly, that is my leadership is constantly evolving,
Yeah.
because with different staff, you have to meet them where they are.
Hmm.
At first, it was a big learning curve,
Yeah.
um, in that it's not about just presenting what needs to be done. Um, Everyone learns differently.
Right.
Some people need to like actually learn doing it, or some people need to be told. Some people need, the structure of graphs and things. So you have to learn who's what and where that fits for every staff member. Um, but I'm still learning my leadership skills. There's still some days, and I'm like, did I say that right?
Hmm.
Or
Hmm.
did she understand what I said?
Yeah.
Or did I understand what she said?
Yeah.
So it is an evolving everyday process. What's important is that you're open to learning and growing, and not thinking because you're the boss that you're always right.
Mm. That's tough. And I think sometimes you have to let people experiment and go off a little bit just so they can feel like they have some type of autonomy.
Well, I don't know about going off, but that's not okay. But
Maybe off. Let's say they want to have a unique social media post that you may
okay,
not agree with, just to maybe do that little thing.
okay. I hear you.
Yeah, don't hurt anybody, I guess. Let's talk about your client avatar. So, what is an ideal type of client for your practice? What do you feel like provides you with a good, you know, dentist experience and also provides you with good profit margin? Like, where does that balance strike for you?
I I love a family to come
Mm,
in and say, okay, yes. What usually happens is funny. A parent would bring a child in. It's kind of like the child is the guinea pig. Uh, bring the child in and say, hey, Johnny has this going on. Can you fix it? And so they see they're right there and they see your interaction with the child and they say, oh, okay, she's good with my child. I think she's going to be gentle with me.
yeah.
And then from there, the mother probably get the father also dragging him in. And then after that is word of mouth for the rest of the family. So I want to be the dentist that you go to as a child and you grow up in my practice. I have so many children that I'm like, oh my gosh, you're getting married, you're graduating from, high school,
Yeah.
you're doing this. And we have moments like, oh my gosh, am I so old? But it makes me feel like I've accomplished something because not only did I earn their trust to be there and stay in my practice, on the long run, I was that dentist that showed them dental care. I was that person for them.
Yeah.
So it makes me feel great.
Yeah, draw that correlation because I love that. Take it in the whole family. It's whole family health. Like people, I don't think understand the correlation between good dental hygiene and overall health. Kind of bridge those two. Like, what does it mean to have good oral health, and how does that affect the rest of your life and your other health metrics?
Oh, there's so many studies that have been done as far as oral health affecting your health systemically, a connection with um, heart disease and periodontal disease, diabetes, stroke, you name it. It is a connection. Most people think of their mouth as not related to the rest of their body. In fact, when they come in and fill out their medical history, they say, oh, all these other things don't matter because you're just looking at my teeth. But it does matter. It
Mm,
matters so much because it's all related.
yeah.
If you're going into, say, I have a patient that has heart issues and going into surgery, you have to have clearance and make sure your oral health is healthy before you go into surgery. So there is a correlation, and most people don't even think as dentists as doctors.
Mm,
So it is it is disheartening in that we are, as dentists, we are the person that influences how your body takes in everything, be it that what you're eating and how you eat and how you speak, everything that you take on as a person, we are that specific field to help you with that, be it confidence or diet or all sorts of things. So dentistry is so much bigger than just teeth.
yeah, I definitely agree. What is like the one or two foods that are really affecting folks' dental health? Like, what is ruining our teeth that people are consuming today?
Well, I'm from Michigan.
Mm.
And when I came down here, I was like, what is this sweet tea? Everybody's drinking sweet tea, but it's basically syrup. So, um, sweet tea is very popular here in the South. And I've found that people sip on it all day long, and that is the absolute wrong thing to do. Tea inherently and coffee are acidic.
Yeah.
And then when you introduce a pound of sugar, it gives the bacteria just that fuel to just cause havoc in your mouth. So like sweet tea, sodas, just basically sipping on those sugary drinks all day long can really do damage to your teeth.
So when people go get their tall coffee with all the foam and whipped cream and they sip
Mhm.
it on the ride to work, sip it for the first 2 or 3 hours, and there's so many people doing that, is that really
Yeah,
eroding our
absolutely. Like I
teeth?
said, coffee itself is acidic.
All right.
And then when you introduce all the sugar from the creamer and the everything else that you put in there, um, absolutely, it's bathing your teeth in an environment where the bacteria is just going to thrive and cause cavities.
So what is the solution? Is it drink it in an hour? Is it, brush your teeth right afterwards? Like always bring a toothbrush to work. Like, what do you suggest for folks?
That is a good way to combat it.
Yeah.
Most people don't bring their toothbrush to work, but I would say if you're going to drink something like sweet tea, coffee, don't drink it over a long period of time, like hours.
Yeah.
Drink it with a meal, and just be done with it. Either rinse with water, or if you have the opportunity to brush, absolutely,
Yeah.
that's the best. Just get that pH back up
Yeah.
so that the bacteria are not
Mhm.
thriving.
Oh, wow. I don't know. It's not going to go over good in Newnan that you're putting the war on autumn palmers.
I know, I know.
So let's talk about, a little bit more of the softer side. Like you're a business owner, and as a business owner, dating could be different. What is it like dating as a business owner? Everybody doesn't understand what you have to do day in and day out. People don't understand, as we discussed, you never turn off. You're always on business. Like, what is it like? What advice do you give somebody who wants to date a business owner? Let's start there.
Well, your schedule might be a little different. It's not a 9 to 5. And you're constantly thinking about the practice. So the conversations might get get a little bit practice focused. But all in all, I would say to be careful for these women out here. I have found, and talking to my colleagues, that um, there are people, men in particular, that are focused on preying on women
Mhm.
who own practices, um, and they're cunning and they want to give you what you feel like you need. But you have to be careful in keeping your business and your personal separate until the time of like maybe marriage or something like that. But it absolutely has to be separate.
I was speaking to an attorney and we were having this discussion. It was at a kind of a conference event. And they say a lot of these things go unreported. It
Mhm.
happens all day, every day. But of course, the criteria is there has to be some wealth or something to be stole for somebody to commit the crime. So that's why it isn't, regularly talked about. Um, Go a little bit more to like, because there's wealth, there does come with risk, right?
Absolutely. Um, for a lot of women in the dental field, we've focused on our career and studying. A lot of the dating practices, we just didn't have that much practice or that much experience.
Yeah.
So basically, we weren't hip on game. So getting out there dating can be difficult in that you just have to be careful in general, of course. But when you have wealth under your belt, you want to just be careful on who you're letting into your circle, because you can't trust everyone.
So let's talk about wealth. At what point in your transition to become an owner? Did building wealth, building those cushions for your business become like top priority? Because my experience is it is an evolution in somebody's life when building wealth becomes a priority. So when did it become a priority for you, and what was happening to make that a priority for you?
I wanted my name to stand for something.
Mm,
I don't have children,
mhm.
and I don't plan on it, but I wanted my legacy to live on in some way. Um, I still haven't figured out how, but I wanted to build a brand in that my name stands for integrity and being able to meet patients where they are. So that's what I wanted. In order to do that, you have to have your own thing. You have to have your own practice. So that was my goal. And looking at that big picture, you have to understand that this is the way to get it. This is the path that you're going to go to get that.
Yeah, I definitely agree with that. So I don't have any kids as well. And you think about legacy different when there aren't kids
Mhm.
in the trajectory, even though I know a lot of business owners, their kids don't want anything to do with the business, which hurts them a lot. That's an interesting dynamic. What do you think about, like, what are some of the things that you put into place to help you build wealth, like wealth independent from your practice?
Um, I must say that most of the wealth that I built is invested into the practice.
Hmm.
I do dabble in the market a little bit, but
Hmm.
I'm no expert. So that's not something that I can speak on, so to
Hmm.
say.
Understand, really understand. So, where do you see your practice 10 years from now? Like, do you plan on bringing on another dentist? Are you increasing the number of hygienists that are under you so you service more of the population? What do you think about the future of your practice?
Oh, 10 years from now. I will probably still be the solo dentist.
Hmm.
I kind of like working by myself. But as far as my team, I must say right now it's interesting. It's a lot of fluctuation in dental practices
Yeah,
because during COVID times, uh, 35,000 hygienists basically quit the field, just left.
yeah, yeah.
And they were either scared and they just went into other fields. And so we were left with hygienists that were just getting out of school. And because there was a shortage, they took the opportunity and understood that they were in demand.
Yep.
So they can ask for what they wanted to as far as hourly. And I mean, now we have hygienists coming out of school asking for $60 an hour, which is, when I started out, that was unheard of because not only do you have to build the rapport with patients and build your patient pool, you have to get the experience of working with patients, just like I did, just like everybody else does. Um, so it is difficult. Now, the hygienist and your relationship with your hygienist is crucial. It is so important to have a hygienist that works well with you,
Hmm.
understands your goals, bottom line. But it can make and break your practice because a lot of the things that the patients were taught to the clinician about, they'll definitely take to the hygienist and they won't ask the dentist. So um, it's important to find the right staff. It is important to get those people that believe and see your vision. And right now, I must say it is kind of difficult because there's a lot of jumping around. When I came out of school, you had hygienists that were in practices for 30 years and they weren't going anywhere. Now it's hard to get hygienists to stay for a couple of years, for whatever reason. So, but I still believe in relationship building, and hopefully that will win over.
Love it. So, what would be the number one advice you would tell your younger self? So, let's say you've already bought your first tranche in the business, still looking to be the owner in the future. Like, what do you, no, let's say for you, you're the owner now, 100% owner. What are you telling your younger self? Like, look out for this, be on the lookout for that, or do this. What are you telling that person?
That's a good question. My younger self, I would say don't take things to heart. Like I said, not everybody is going to like you. Not everybody's going to think that you made the right choices. As long as you're okay with the choices and the consequences that come with it, just hold true to yourself and understand that there are boundaries that need to be that need to be drawn. Both, like I said, you have to be vulnerable with your staff and let them see you as a person, but you don't need to be friends. So that's kind of a touchy subject, and that they need to know that you are the boss, you're approachable,
Yeah.
but there is a line that should not be drawn. There's a line that is drawn, basically. So
It makes sense. So if somebody's listening to this and they say, I'm in the Newnan area, the Atlanta metro area, I'm willing to drive. What is the best way they can reach out to your practice to help them with their oral health?
absolutely. You can go to Dr. Ria Sahara on Instagram and Gentle Dentistry of Newnan on Facebook. Also the website newnandentistry.com, and come and see us.
Well, thank you very much, Dr. Ria Sahara, for joining us. I think we covered a lot of ground. Buying a business, operating a business, marketing a business, promotion, and even employee relations. That's really kind of a big deal. So thank you very much for joining us today.
Thank you.
Take care. Feeling the pressure? You're not alone. I'm Randall Lavery with Diesel Wealth Management, and I specialize in simplifying wealth for those who are near retirement and business owners. We'll create a plan that fits your unique needs so you can actually enjoy the wealth that you built. We consider our firm results-driven with a touch of fun. Ready for clarity? Click the Learn More and schedule your free discovery call. Let's build the financial future together.
The more I know, the more money I can make.